Matter.
Good Count Corda. Minister, I want to raise with you the issue of the level of funding for the local and regional drug and alcohol task forces. At the outset, I'd like to thank you for the time that you took last week to meet and update me on the progress being made with regards to the implementation of the current drug and alcohol strategy. During that meeting, we discussed a number of issues, but one of the issues that I highlighted to you was my concern at the level of funding that drug and alcohol task forces are receiving. That funding both for regional and local drug and alcohol task forces. And I believe you're sympathetic and you understand the problem. The problem is, Minister, we have to convince your colleagues and members of government that this is an issue that needs to be addressed. It's worth putting on the record of the House that the funding being proposed for 2019 is exactly the same level of funding as was made available in 2018. And the 2018 funding was the same as the 2017 budget, and as was 2016, 2015 and 2014. For all of those years, the budget allocation has been the same. And 2014, as a matter of interest, was a reduction on the previous year of 2013. And I understand why. We had a recession, and I acknowledge all of that. But we have come to a point in recovery. Drug and alcohol task forces are primarily funded by the HSE and the Department of Health. Funding going into the parent department year on year is increasing and increasing significantly, and these projects are being left behind. It's important to point out, Minister, that they're struggling to survive and maintain the existing level of service. In terms of salaries, the people who are employed, and in terms of to meet new and emerging challenges. They're under huge pressure. And I know, Minister, when you're replying, because I've asked these questions in the past, you're going to say that there has been additional one-off funding made available to improve the organisational effectiveness of the task forces. And towards the end of the year, there was additional funding. If that additional one-off funding had been built into the base as core funding, year on year we'd be seeing a growth. I have very real concerns of the effectiveness of one-off funding, Minister. I think it is a challenge to task forces to engage and to introduce new programmes to spend that money. And in real terms, when the funding runs out, the problem is still there to be dealt with. Unfortunately, it's the reality of the situation. The work that the people involved in our drug and alcohol task forces, the projects and programmes that they support in our communities, that demand is a continuous demand. That's a regrettable thing to say, but that's the reality of the situation. We will be facing treating addiction, minimising its impact for a long time to come. And if these programmes and projects are to be supported, they need to be supported financially. I can see no reason at all, Minister, why, when the health budget was increasing year on year, that the base and the core funding going to the task forces has remained the same since 2014. I find it absolutely incredible. And apart from the physical strain it's putting on the providers of these programmes and projects, it undervalues them. People feel that they're being ignored, that the work they're doing isn't being recognised, that they're not getting the same recognition as other groups. Minister, I don't know of any other group, whether it's capitation fees in schools, whether it's grants given out by Minister Ring to Rapid Area and so forth. I don't know of any other programme that has been left static for that period of time. And Minister, I'm not blaming you on this whatsoever. I genuinely believe you understand this issue. I genuinely believe that you realise the work that the task forces are doing. But between us, and not just the two of us, other members of this House, we need to convince the Minister for Health and the Minister for Finance that the 2019 budget that was announced, the funding that has been made available for 2019 is inadequate. And rather than coming at the end of the year with a supplementary budget, that budget needs to be amended at the start of the year, so as the money can be spent wisely and can be spent in a managed and effective means to achieve the programmes that are set out.
Minister, the floor is yours.
Thanks. There's a lot there. Thanks. Thanks, Cloncorley. I want to begin by thanking Deputy John Curran for raising this issue, which I know he's very passionate about, so am I. But I'll just go through some of the speaker notes and then I'll refer to some of the issues that's been raised by Deputy Curran. Government's policy in relation to drug and alcohol addiction services set out in the National Drug Strategy Reducing Harm, Support and Recovery, a health-led response to drugs and alcohol in 2017 and 2025. Providing additional resources to enhance services provision is a key objective of the strategy, and I welcome the additional funding provided for an integrated treatment services for people in addiction and mental health issues in the HSE in 2029 National Service Plan. The Service Plan also commits to improving healthcare services for people who are homeless. In addition, the Service Plan will deliver more integrated and effective models of care with complex healthcare needs and experiences severe health inequalities. The Drug and Alcohol Task Force play a key role in assessing the extent and nature of substance misuse in this area, and its important community's response as part of the coordinated approach involving all sectors at local and regional level. A total of 27,645 million was allocated to drugs task forces by the Department in the HSE in 2018. The level of funding has been maintained for the past number of years. A further 0.5 million in a once-off funding was provided to task forces in 2018. In addition, the task forces were consulted by the HSE on the provision of 0.71 million in once-off funding for priority projects and services in the CHO areas in 2018. This funding is used to support community drugs projects in delivering which meets local priorities. I am very familiar with and greatly appreciate this valued work in the local communities. Measuring the overall effectiveness of the response to the drug problem is an important object of the drugs policy resources. Should be directed towards interventions and strategic which are most likely to lead to a reduction in problem substance misuse and the improvement in public health, safety and well-being. The level of progress achieved in delivering on National Drug Strategy will be determined using performance indicators. To this end, the National Drug Strategy committed to operational and performance measures system by 2020. The system is primarily concerned with the overall effect of implementing the drug strategy at the population level, including the effects on health, well-being and the quality of life for people living in areas served by the drug and alcohol task forces. Last year, I established a working group to revise and update the handbook for the task forces, intended that the revised book will provide an overall governance and accountability of task forces, and I hope to have that shortly in the next 2 or 3 weeks on the desk. In particular, the group is developing a governance code for task forces in line with best practice out by a charity regulator. I think I've mislaid a page somewhere in my open statement, but I can't seem to find it, so I'm sorry for that. I will come back to Deputy Curran with some of the issues that he's raised after.
Thank you, Minister, for your response. In your response, you make reference to the fact that there would be an overall effectiveness model. I just want to bring to your attention that that's a reply I got from you on the 23rd of January 2018. It is taking a long time to implement, and at the same time we're expecting the task forces to effectively operate on the budgets of 2014. That's not doable, it's not possible. And while I'm all for accountability and measuring the effectiveness of the various programmes, in the meantime, these projects have to be funded. And the concern I have is that the lack of funding will mean that the projects won't be as effective as they could and should be. You also make reference to the fact that there was one-off and additional funding. I still believe that that isn't the most effective use. I know when it becomes available in a department, that's a method of using it. But core funding, where you have managed programmes, the certainty they give, the effectiveness, the time that goes into setting up programmes, in as far as possible, increasing core funding is far better than one-off funding. I just want to conclude by saying, Minister, last Monday night, and I want to use this as an example, after our visit to mark the centenary of the first sitting of the Dáil in the Mansion House, I returned to Cronan and Clondalkin, where the Clondalkin Drug and Alcohol Task Force had an evening to present certificates to a number of people who were graduating from the Addiction Studies course. And I was chatting to them, and two things that came up that were of interest. I was talking to the coordinator from the task force, who reminded me that when the task force was established back in the late 90s, the catchment area for which the task force was working then was 35,000 people. Today it is 117,000 people. And they were getting more money then than they are now. It is an impossible task we're setting them. And when I was doing the presentation, it dawned on me that some of the people had come from far and wide, and I asked, was there a huge interest in the course or whatever? There were 20 people graduating. Over 70 people had applied for the course, and I just asked the coordinator, why were there so many? Because other task forces haven't got the funding to run a course like that. Minister, that is an example of the impact of the restricted funding that has been made available. It is not tenable and it is not feasible to say we'll wait and we'll have a new model next year. What I'm appealing to you is to go back to the Minister for Health and the Minister for Finance and this year's current funding, that there would be an increase in allocation of core funding rather than during the course of the year one-off additional payments. And that brings us forward year on year. The base has been eroded significantly. It is at the lower level that came in 2014 has remained there, and it really needs to be urgently dealt with because the programmes and projects that should be supported in our communities cannot be adequately supported at this level of funding. Minister, to conclude.
And just thank John again for his remarks. I just want to make very clear to you, Deputy Curran, that Taoiseach and Minister Harris were very much part of the launching of the new strategy reducing harm, support and recovery, which was a public document which was made to be the document it is because of public consultation right around the country. And in all of those public consultations, it was very clear that task forces weren't happy because funding hadn't been increased. However, in saying that, we won't talk about the past, we'll talk about the future. In issuing money there at the latter part of the year, was very conscious of the fact it was only short spurts of money and it was only just filling small holes. And I intend over the next coming weeks and months to look at the envelope that has been given to me now and to look at options and consider options for provision of additional funding to task forces. But I just don't want to give out money willy-nilly. I want to make a real impact and I want to have that core funding from one year to another. I don't think it's good enough to be able to just give short bursts of money to any group and expect them to do work on that. We do need continuous funding and I will be looking at that. And however, even though we didn't have much success in getting money through the budget, we did get other money in the last couple of weeks, and it's that I'm intending to look at over the coming weeks to establish how that can be best spent within the task force areas, and as well too around the task force handbook. I think it's important that the last task force handbook was out in 2011. I think it was time to look at the structures of the task force and to see where we could make, I suppose, gains, and where some things that haven't happened really well, we could change that as well. And it's been a very positive reaction from the people who are on the task force looking after the handbook. And as I said, I hope to have that by the end of the month. However, I do agree with you in many ways that you cannot continue to fund projects unless you can establish a fund that is every year. That just doesn't happen on a once-off basis. We haven't been lucky in the past. As a matter of fact, last year was the first time in a very, very long time that the Drugs Policy Department, and you know this best as I do, that there was even any money allocated to them. And in that time, the 7 million that was allocated 2 million of that went into mental health and homeless, and the other 5 million was spread across the strategy and implemented in other parts of it as well, not only within drugs task forces, but in communities and within the HSE as well. So I'm confident, I have to say, in the coming weeks and months that we will start to make an impact and start to relocate additional funding through the task forces. But it's not going to be funding for anything. It's going to have a core reason why that funding is going to go in. I'm of the belief myself that, that the only way to strengthen task forces is to give them continuing funding. But to do that, we have to have a proper model. And I have looked at some of the issues around task forces, and I've looked at many reports that have been issued as well. And for us to get this thing right, I really think it's important that we begin this year by making sure that any money that is available to task forces is well located and well strategically located within task forces to make the difference on the ground. I think we're singing off the same hymn sheet, John. I just think I need a few more weeks to be able to put in place some of the funding that has been made available and to look at the core reasons where we should be spending it in task forces and communities.